Thank you for visiting Lincoln Thyroid Care website here. My name is Dr. Chad Miller. I set up this informative website to let people know a little bit more about thyroid and how they can address some of the problems that they're still currently having, even when they're on medications for their thyroid. Right now, like 20 million Americans are dealing with a thyroid disorder, about 1 in 13 people. And I think National Women's Health Center said something like 1 in 8 women will experience a thyroid disorder of some sort in their lifetime. And the reason is not commonly known to most people as to how or why they get these thyroid disorders, only that here's your symptom, here's your pill kind of approach, or here's this test of a TSH, here's your pill, good luck to you, and then we'll chase the symptoms with other pills. The problem is most doctors are only vaguely familiar with thyroid disorders, and it's pretty sad. Even when I recommend or request testing from medical doctors around the state, even they're uncomfortable even ordering some of these tests because they're unfamiliar with those tests, even when I provide explanations as to why we're looking at what we're looking at. They're like, no, I don't want to do with that. Let's just refer out to an endocrinologist. That's fine, but this is within their scope. This is easily a test or testing that can be done to really get at the root of the problem instead of just skirting the issue and just looking at one very small piece of the puzzle, one very small part of something that really doesn't give us a ton of information. Granted, the TSH and even the T4 testing is important and gives us a important look at what's going on, but it's very, very small part of the whole cascade of what all goes on with the thyroid, how it's disseminated through the body, how it's produced, how it's broken down and utilized appropriately, how it's taken from one area to the other. All of that can be looked at and appreciated as far as areas that might be clinically managed a little bit better than just hormone supplementation or hormone addition. It's kind of sad, but unfortunately 90% of women on thyroid medications will continue to suffer with their symptoms, and I kind of go into that, the why, on this DVD that you feel free to request if you'd like. But the whole idea of this DVD is to kind of go through the common reasons why people get these thyroid problems, how to tell if you have a thyroid condition and some of the symptoms they have, how some of these are even reversible or may not even need medication, may not need hormone replacement. Sometimes that's actually not even the answer, and this is why many women don't get the answers they want or desire, even though you're being treated. And then how to possibly fix that condition, or how to address or manage this correctly and appropriately without beating yourself down on a regular basis and without spinning your wheels, not going anywhere on some of the medications that you're on. And then, what I'll also kind of go into is what tests are appropriate, what tests are, needed to take a deeper look. Looking at cortisol levels, looking at the full thyroid panel and not just a simple TSH look that gives us a microscopic view as to what's going on with the thyroid, and actually better look at the pituitary gland. Looking at blood sugar, looking at all of the spokes on the wheel, and if you're not addressing all of those spokes, odds are you're probably going to have a pretty bumpy ride. So that's the purpose of this DVD, is to let you know that there's more out there, more available to people than what's even most doctors even know about. The lab companies like LabCorp here in Lincoln, Nebraska will tell you exactly what tests are available, and they're all right there on the front of their sheet. These are all here. Doctors just are unfamiliar, think it's a waste of time. Well, it's a waste of time if you're correctly managing the symptoms or correctly managing the case. If you're not managing that case, keep looking. Look deeper, look further, and look at the whole picture, and look at that person as a whole person, not just a simple TSH number. Important to me, important I think for my family, important for my patients, but unfortunately in the medical model it's not that way. So what I've done is compiled a lot of this information, put it on a DVD, let people know how we approach this, how we test for this, what we do in the office, what we do, have you do at home, those kind of things, and give you a better idea of what to expect if you were to come in and have us take a look at something was going on with your thyroid. So fill out the form here off to your right. Let us know that you'd like us to send that DVD out to you. We can send that out to you, and you can feel free if you want to give us a holler and want a consultation and have a visit with me. That's fine. If not, then no harm done. So again, fill out your form. Fill out as completely as possible so we can mail that information to you, and that would be it. You contact us after that. We won't contact you. So, all right. Thank you. Have a great day.